Good afternoon, everyone. Gareth Presch, founder, CEO of the World Health Innovation Summit. Delighted to welcome you to Scotland at a Crossroads. We'll be looking at prevention, investment and social impact. I'm joined by a series of colleagues here, experts in their field, Professor Niven, Rennie, Gerry, Hamill, Lorraine, Giles, and also Lee Whitehead. What we're going to try and do is look at how can Scotland lead, transformation and inspire the rest of the world in terms of impact investing. And we're also going to look beyond short-term fixes. We want to look at a prevention economy, a well-being economy. How can we drive investment into well-being, deliver real social return on investment? And we'll also explore Scotland's pathway to a well-being economy. We want to look at sort of new models of healthcare around social prescribing, digital health, and show that there is quite a significant ROI in investing in these models. So let me just go around the table and ask everyone to do a short introduction, and we'll start with Niven. Niven, it's a pleasure to welcome you to the session, and the floor is yours.
Thank you, Gareth. Well, it's a pleasure to be here. My background, I was 31 years a police officer, and then I ran a third sector organisation, a homeless charity in Scotland, before becoming the third director of the Scottish Violence Reduction Unit, which opened my eyes really to a different way of doing things. Public health approach is what they're recognised as having introduced to Scotland, and that is really understanding that we don't reduce demand on services by responding to them. We reduce demand on services by preventing them, by understanding the causes and tackling these. And in a violence perspective, for example, we realise that we can't tackle them just by policing and justice alone. You need to involve partners in health and education and elsewhere. From there, I went on to work with the violence reduction units across the United Kingdom, where I met my good friend Lee, who will be coming on to speak shortly, who told me about social impact funding and how he's involved in it in England and Wales. And I look back at some projects we ran in the violence reduction unit, really good projects, taking people out of prison, stabilising them, getting them into employment. And we had to close them down because the funding ran out. And had I known about social impact funding at that time, I would have tried to expand that across Scotland rather than close it down. So latterly, I'm going to have the opportunity to do that by working with Gerry and Lorraine and others, including Gareth and Lee, to try and get social impact funding to have that effect across Scotland. And that really is my background and why I'm here. Thank you.
Thanks. And let me bring in Gerry.
Thank you, Gareth. I'm Gerry Hamill, and excited and proud to be director and part of the founding team at Social Impact Scotland. I'm also the founder of UPHOC and the Scottish charity Hidden Voices. My background is predominantly from the private sector in business development and commercial growth. But over time, I found that my work has shifted to the intersection of investment, prevention, and human potential. Think less consultant, more curious human being. Someone who believes that we already have the potential to deliver the solutions that we're all seeking, we're going to talk about today. I'm particularly interested in what I call prehabilitation, the idea that we build strength before it's required. That's less about fixing what's broken and more about growing what's possible. And perhaps why I'm here today is to bring a human lens to the conversation amongst these pillars of prevention that are lined up alongside me. One that connects prevention not only to data, but to dignity, to belonging, and to belief. Thanks, Gareth.
Fantastic. And let me bring in Lorraine for a bit more belief.
Okay, hello, I'm Lorraine Gillies. I'm pleased to be here with my Social Impact Scotland hat on. I have a number of other hats on, though, that I think are kind of worth mentioning. I'm currently the co-chair of the independent working group looking at how we prevent antisocial behaviour in Scotland. I'm a director of Community Justice Scotland. I'm the associate with an organisation called Winning Scotland, bringing the Icelandic model of prevention to Scotland in the guise of Planet Youth. I'm the founder and director of a neurodivergent organisation working with neurodivergent women, of which I am one of them. I've spent a fair bit of time in the third sector and the public sector, and a wee bit of time at Audit Scotland. And all of that has led me to this place, to really thinking that we need to do something differently with the public sector and the wider civic society in Scotland. We really need to think about upstream prevention. We need to think about outcomes, and we need to do things differently. And I'm really looking forward to today. So thank you for having me.
Thanks, Lorraine. And doing things differently, Lee, you're a pioneer in that space.
Oh, thanks, Gareth. Lovely to be here. And as Niven said, Niven and I have worked on a charity for young people across the UK, and we've shared a lot there. My background is developing social impact projects for the last 10 years, and developing those around the initiatives of what you've already heard. Prevention, let's work before people enter into that crisis area that costs a lot more, and they're engaged with services for a lot longer. Trying to stop that in the first place, whether that's, a future career for somebody in the justice area, or in and out of hospital for years, or being homeless. These issues are around, and over the last 10 years, about 200 impact projects have gone live in the UK, only a handful in Scotland, and there's been some interesting different views about them in Scotland, but across England and Wales, there has been a good movement forward. And I'm just going to link to what Gerry said there, is what makes them work, because he was touching on it. They are essentially transformational. They create a different form of investment to do something new, to pilot and create a new way forward. Yes, they're about measuring outcomes, and there's a lot of data heavy aspects to social impact, but that's because you want the evidence. Going more around what Gerry said, they are most effective when they are very locally based, and very much with the agencies coming together to form an integrated whole of what they're going to do, usually around quite complex problems. I think they have particularly good outcomes when they co-produce with the people who will actually use those services, participate in them. And a term that I'm quite familiar with now, that's part of the research I'm doing around impact, is they are essentially human learning systems. In other words, they are very much around people, and some of their issues are understood in a very human way, not a clinical or a numbered way. They are understood in a human way. They learn because they evolve and adapt over their lifetime, usually 5 to 7 years. They're not about a flash in the pan. They're about longer term sustained change. And systems means that they involve the whole system, the integrated way of looking at something. Somebody who has, shall we say, I don't know, an offending history will have done something that has brought them into that, but usually there's a whole history around their experiences, their trauma, maybe mental health, their doing in their younger years around what school and what other opportunities weren't there for them. So a systemic look is a good one. A learning, an adaptive way is a good one, and very much a human focus. So I think social impact is all about those things.
Okay, great. Thanks for that, Lee. So let me just set the scene. I think we're all aware of the public service pressures that we're all under across the UK. And I think it's very important that we look at new models of financing. Of course, this is the topic that we're there today. So anyone that's listening in here today, please, if you have any questions or comments for anyone on the panel here, please put them in the chat, and we'll put that to our panelists here this afternoon. Let's start off with quite an easy question, and we'll go to Niven and the team first of all. Niven, how can Scotland embed prevention first approaches in health, justice, and community policy? Not a difficult question.
Not a difficult question, because we're all contending with it. But I think, I mentioned my time at the Scottish Violence Reduction Unit, which had recognition worldwide for doing things differently. We always thought about violence being a justice issue for the police and the courts to resolve. And we went round the houses with huge campaigns to reduce violence, which never really worked. Our prisons became fuller. We put a lid on a boiling pot, if you like. But as soon as that lid was released, the pot bubbled over and the violence started again. So a fresh approach was required, and we took that fresh approach by recognising that we could prevent violence from happening. Now, as you start to investigate that, you come across a statistic which I often refer to, that 1% of the Scottish population experience 65% of violent crime. And if you start looking into that 1%, you will find that they also are the people with the worst health outcomes, the worst educational outcomes, who make up a lot of our statistics in relation to drug deaths and all the other issues that Scotland contends with. And my view has been, what have we tackled that 1%? What if we gave them better opportunity, hope, aspiration at a younger age that stopped them heading down these roads? But to do that, we all have to work together. Unfortunately, we tend to work in silos. So we have a violence reduction unit, we have a drug deaths task force, we look at homelessness and isolation, etc., etc., etc. And therefore, as Lee describes, the crisis becomes worse, the demand becomes greater, and we end up having our public services chasing their own tail when we haven't really worked together to try and prevent it. And I think this gives us an opportunity for a new model where we do work together. We work together in a preventative way to try and give our young people a better chance. And as they grow into adulthood, to reduce that level of demand and break the cycle with which we've been contending for generations. That's a very quick answer to a very complex question, Gareth, but that's where my mind is.
No, that's excellent. And what about Gerry? Your thoughts on this topic? Oh, you're on mute. Oh, I think we've lost Gerry. Lorraine, I'll come to you.
Okay. So right now in Scotland is a very, very good place to start thinking about prevention, because we've been thinking about it for such a long time now. But that's the problem. I think we have a number of policies and frameworks and strategies all in place that encourage us to really do things differently, but we don't have a mechanism. And I think my sort of overarching thought process is how do we get past all these strategies and frameworks that we have? I mean, people will be familiar. We piloted the violence prevention work. We have a Public Health Scotland, and we have a new population health framework that's rooted in prevention. You know, we have we're in the middle of public sector reform. You know, we've got government ministers coming from a kind of finance angle, thinking about how do we do things differently in Scotland. But we're not managing to progress it in the way that we did. Some of you may be familiar with the infamous Christie Commission. Way back in 2012, 2014, those of us who were in the game and had skin in the game were thinking, yes, this is brilliant. Here we've got a game-changing piece of work that we can start to do things differently with. But actually, nothing really changed massively. Niven talks a lot about silos. And I think for me, that's the kind of number one issue around why we're not moving forward, because everyone has their own little pot of money and they're very reluctant to see it shift. I think the other issue that we're all getting our heads around is this notion that we do something now, and actually we won't see that change happen for 5, 10, 15, maybe even generational. And I think given the electoral cycles that we have at the minute, that's very difficult for our elected members and our decision makers to understand and to cope with. Very recently, I'll sort of finish with this one. Our First Minister in Scotland, John Swinney, who most of you may know, is very much behind something called the whole family approach. And it's along this idea that a child, a family may need a number of different interventions just to enable them to stand still. But we need to do much better than that. We need to really think about where is the early intervention, where are the earlier things that we can do, perhaps pre-birth, perhaps pregnancy, all of that stuff, but we never really have got our head around that. And it will be about breaking down those barriers. It will be about that silo working. It will be about those budgets being ring-fenced to do things right now. And it will be about trying to find new ways to bring money into the system to fund those things like youth work, like stroke services, like healthy eating services that will make the difference. But I think in Scotland we've got a listening landscape. I think we've got a good policy infrastructure, and we think that social impact may well bring the mechanism for change that we need to have.
No, I think it's a fantastic opportunity, particularly yourself and Niven and Gerry. And we just lost Gerry because he's had a power cut at home, just so people are aware, but he'll hopefully join us again quite soon. And I'll come on to discussing with Lee sort of the fiscal aspects and the economics, and sort of how do you bring the private capital to support this sort of economic transition, because you're going to have to mobilize private capital. But it's important for people who are listening in here or, you know, taking an interest in this webinar to understand that what we're facing at the moment is a crisis of ill health, and ill health reduces our labor market. Our labor market then, of course, means that we can't borrow money and GDP can't grow, which ultimately means that your services have to be cut. And that means your NHS, and that means all your social care, they have to be cut. So we're in a crisis. But if we can pivot this model, and we've proven this model, this is the model that we have, the WHIS model, which is all around prevention. Lee will go into the aspects of this, and we can actually save a lot of money over the course of a term, even for government. And that's where social impact contracts, outcome-based contracts come into play. Lee, I'll come across to yourself. So what are the investment, public-private blended finances? What are the offers that are there at the moment that can support early intervention?
You were just leaning into the policies there, and let's just be clear what's in place. So within Whitehall government, and I know also in Scotland, there is an interest in having business work alongside our public sector, not in a undeveloped way. We've had these previous types of iterations, like the private finance initiative in health, where, you know, developers built things and hospitals and then they leased them back. We've moved on a great deal from that. This is much more a real partnership, working alongside a local business or set of businesses in a town, in a city, and asking them to, you know, they have a vested interest in employees from that town or city, or they have a vested interest in what's going on there. Asking business to come forward, and it isn't so much as a private investment, Gareth. It's more of a social investment, and I think we have to understand what that means. So a social investment is one that is going to make a human difference. Although, you know, there about 20% of all impact projects are around environment. I generally only work in the people side of social impact. But either way, what you're doing is investing in a different way forward for a range of people who have a set of challenges. Traditionally, those will be understood as things like unemployment, perhaps poor health, yes, homelessness, offending, these issues of our time, which are increasing. You know, the single biggest rise in unemployment, although it's generally plateaued, is in young people. That's a brooding issue for the future. That is going to come back and bite us. So how do you deal with that preventatively? Well, one of the schemes, and I'll move into an example because I always think examples are easier. One of the schemes I've recently been doing that's gone live in a city in Northern England has really just offered the opportunity for training and employment for young people who are already in those communities, and they're causing a bit of an issue. They're causing a bit of an issue with antisocial behaviour, and they live there, and there are issues around that generally for the police and the area. Now, what a bunch of businesses did was come together and invest into that. They invested through a social impact product, and what they did was put forward the money and essentially said, we want to work closely with about 250 people a year, offer them mentoring, support, training, real skills, in-job coaching, helping them transition at 18 and 19 and 20 into real jobs. And actually, because of the nature of these, the investor, they were able to pick up all sorts of work and employment opportunities in the construction and the range of jobs that go alongside construction. So this was a very simple deal when you think about it. A set of businesses in an area decide to say, we're going to work with 250 people. Why would they do that, Gareth, you may ask? Well, these are future employees. They want to have those young people trained, skilled. Plus, these organisations also work and live and develop in those communities. So it's a real hand-in-hand piece of work whereby an investor takes a real interest and does that. There are many foundations, there are many institutional investors who want to do something, to use an old word, philanthropically. They want to do something that is socially valuable. The key issue is in an impact product, we just need to make sure we measure that, prove it, track it, and show that, going back to that example, those young people get that opportunity, take up those jobs, stay in those jobs, develop and grow into young adults with that level of support, because we know that makes a fundamental difference to some of their past behaviours and things they were getting into. So that's a little example of how an impact project works. The government in Whitehall and also in Scotland and over in Northern Ireland and Wales are equally interested in this type of project. And they're interested because of those sorts of benefits in that description I've just given you, because everybody wins. Business wins, community wins, those young people in my example win. Why wouldn't you do that? The reason why it's becoming more prominently sensible to do it is many of our public sector bodies are running just as fast as they can just to keep up. And they haven't got the opportunity of these new or developed different ways, these transformational ways of doing stuff, because they're fully dealing with the emergency, the urgency, the crisis. They've got no new money to do that. Actually, governments are starting to say impact projects will get behind them. For example, the recent announcement of the Better Outcomes Fund, the Youth Futures Fund, which will be a way of matching funds with investors to promote more youth-based opportunity. And I know there are other projects coming forward around health and housing, etc., under a similar type of scheme. So, I mean, I think we just have to step back a bit and say, you know, you asked me what's coming, what's available through an impact method. Well, it's the social return. The return is greater than the cost, and that return starts to see people moving away from increasing attending of crisis-based services into much more managed and supported structure, so that they are able to move through and into a more settled arrangement.
Brilliant. Thanks for that summary, Lee. And let's bring it back to sort of Scotland, local level, the human side. Gerry, if I bring you in, I know we lost you briefly there, just around how can Scotland embed, you know, prevention first approach, and you, if you could give some context, just following on from Niven's lines and Lorraine's from a local level, that would be fantastic. I think you're on mute.
And that just about sums up the past half hour. Vieira experienced a power cut and off I went, but we're back. So I managed to miss the wonderful Lorraine. I did hear Niven and a little bit of Lee. So I suppose where I'd like to start is by saying that it's always heartwarming to connect when connection allows with values aligned and purpose-led colleagues. People who care not just about what works, but why it matters. And I guess the point of today really is, it's not simply that we need to do more, it's that we need to do different. Because if effort alone was enough, Scotland would already be flourishing. We don't lack commitment in Scotland. What we often lack is coordination, and dare I say, creative inclusivity. A shared space or a shared sense of where to place our collective weight if we want the system to move. And we talk a lot about prevention, and I might be a little bit controversial now, and I sometimes wonder if the term, along with the terms disruption, intervention, diversion, have become too comfortable for us. They've served us, and I'm not sure they still stretch us. That's maybe a conversation for another day. But when you look closely, prevention often comes itself too late. I'd like us to walk down a different path, and that's the path that I mentioned before of prehabilitation. For me, prehabilitation demands something more from us. It raises the bar. It asks us not to simply look upstream, but to travel all the way to the precipitation zone, the very source where we can design environments that prevent challenge from ever taking shape. Words create worlds. We became more aware of that in politics and media recently. For example, if we describe people as problems, we design systems to contain them. If we describe people as potential, we design systems to grow them. And that's a quiet kind of revolution that I see prehabilitation, a shift in language that leads to a shift in power. And in that sense, I genuinely believe that we suffer collectively from aspiration poverty, not just as individuals, but collectively, as communities and systemically. And prehabilitation will ask us a deeper question. What if we invested in strength before strain? What if we built capacity in people and communities before they ever reached breaking point? In clinical terms, prehabilitation is what prepares a patient for surgery. In social terms, it's what prepares a person, a family, or a community for hardship. When we frame prevention as investment, not cost, we start to see early action not as a charity, but as smart economics. That's the principle I believe behind Social Impact Scotland, creating a mechanism that allows public, private and philanthropic capital to work together for measurable, sustainable change. And we already have proof that this mindset works. The Violence Reduction Unit, as Niven spoke so powerfully about, showed us what happens when we treat violence not as a crime to be punished, but as a symptom to be understood. When we change the lens, we change the outcome. Homicides fell, hope rose. And the same is true elsewhere in health, in education and employability. Every pound invested in a child's life saves multiple pounds later on in crisis intervention. But if you can bear with me and give me a minute or so. Beyond the number lies something much more profound, Gareth. And that's the quiet transformation of how people feel when they're seen, they're valued, and they're supported. In 2019, I met a young man whilst delivering a Hidden Voices project in Edinburgh Prison. And he told me very glibly that his life was as good as it gets. His rationale for that was he had 3 square meals a day. He had a dry room to sleep in. He got to go to work every day and he made a couple of pounds a week, which he could buy small comforts with. He could go to the gym. He had friends. What he didn't have were any tools, skills, or life experience to contradict that crushing lack of self-belief. His sentence and sentiment have stayed with me ever since, not because it was tragic, which it obviously is, but because I actually understood it was true for him. He had never known what it was like to be invested in, to be believed in. So for me, prehabilitation gives us a new language, a language of aspiration rather than authority. It shifts the focus from compliance to confidence, from managing people to believing in them. And I think that's where hope lives. Because for me, hope isn't the end game, it's the beginning. Hope is built when we act like others matter. And hope is not blue sky thinking, it's a strategy for change in itself. And if I can finish with a belief that I believe Scotland is rich in passion and pilots, and rather ironically innovation, but poor in pipelines. We have brilliant people doing brilliant things in pockets all across the country. But for me, the truth is that too much of our progress still depends on personality rather than policy, on moments rather than mechanisms. The time for me surely has come to connect all the learning that we have, the learning that Lorraine and Niven and Leo have spoken about, into a national investment framework that funds what works and what grows what matters. And that, I think, is the purpose of Social Impact Scotland, to bridge finance with fairness and to turn prevention into participation. we're building an ecosystem where social investment's not about return, but about reinvestment in people and families and in human potential. So my invitation today is quite simple. Let's stop asking who's paying for prevention and start asking who'll benefit from its success. Let's stop asking what could go wrong and start imagining what could go wonderfully right. Because the answers, if we get this right, are all of us and everything. And power cut aside, that's me for now, Gareth. Thank you.
Oh, it's brilliant. Thanks, Gerry. Like, it's such an insight, and I completely agree with you. We need a complete wire reset, a paradigm shift in our mindset, in our thinking. When you spoke about pipeline and shall we say, sort of like the projects, we'll come to Niven shortly, but just to clarify a couple of points, because we've had a couple of questions come in from Fiona Gray Taylor, and we're obviously covering all aspects of community here, not just youths. And just I'll pop over to Niven now, just for some context from a project perspective, and then we'll go around the houses and do some final thoughts.
Yeah, so one of the questions Fiona asked, are we focused mainly on youth? And I just want to stress no. We have talked about that a lot. I talk because my personal desire to give young people a better start. But social impact funding can be used for all sorts of social problems. It can be used to help people, stop people in care homes or going and staying in hospital. It can be used to reduce the public demand across it. Having run a third sector organisation, I'm acutely aware of how difficult funding is. Under current models, third sector organisations, charitable bodies rely on grants, which they have to apply for. The grants are oversubscribed. You can only apply when there's a window, and you struggle against other competitors looking for the same money. And very often the service and the people who work in that service rely on that grant funding. The second means is by procurement, where the public sector decide they want, for example, a homeless service, and will say we're prepared to pay £1 million to a company to deliver a homeless service, and you have to bid for that against competition from elsewhere. So you cut your costs to try and get to be the preferred bidder. These systems aren't set up to support third sector organisations. And the second element, which really annoyed me, is that you don't get a seat at the strategic table. You deliver some essential services without it being able to contribute to how these services are designed, and actually you just become a servant of the people that are paying you the money. This offers a third way. This offers a way in which third sector organisations can be at the strategic table, because you form a partnership with both the funder and the outcome pair, where you each have a voice at the table. And it gives continuity, because although it goes for year to year in measurement, the design has to be transformational, as Lee said. So you actually gain 5, 6, 7 years of funding through an impact project, which allows you to retain staff, develop your organisation, and no longer be required to bid every year for the money you got the previous year. So there is so much that can be done with impact funding across a range of services. But for me, that desire to give the third sector organisation equal status and longevity is another really attractive feature.
Yep, I think we've got a lot of opportunities. I think there's a question that's come in here, Lee, from Ellen Tomlinson, which I think you covered earlier. How do we ramp up convincing businesses investing in early prevention measures in communities as a commercial sense, not just a nice to do? Perhaps you want to elaborate a little bit on that, Lee, because I think that is a significant opportunity. I think there's huge scope for businesses to get involved. Go ahead, Lee.
There is. Thank you, Gareth. So I'm going to touch on three ways that can be stimulated. So there is greater levels of investment. Now, the first thing that can be done is that the public body, the government, can help. So it could offer a small amount, maybe only 20-30% of an investment. That helps smooth the whole thing, and they match fund it in a sense. It's exactly what's happening with the Better Outcomes Fund that's been announced at the moment. So there's going to be an announcement of about 30 to 40% of that is matched, but the other, shall we say, 60 to 70% comes from the independent or the social investment sector. So governments can help stimulate it, and over the years that's happened about 3 times, and maybe about 50 to 100 million pounds has been invested in through civil society into stimulating more of these projects. As I say, there's about 250 across the UK. There's about 4,000 globally, and some countries, Australia and some of those in Europe, are massively supporting this type of project. The second thing isn't just about money. It's about softer strategic support. It is about local authorities, combined authorities that group together local authorities, governments devolved or otherwise, actually saying, we quite like this idea of prevention, and we quite like this idea of learning, developing, giving some of the say in how these designs come together to people in those communities. It's a shift, it's a democratization of it, and it's right, because people know what's best for them. If you talk to somebody who's been involved in mental health services, they will tell you they're in and out of so many doors, and they see half a dozen people before they even get anything like a service. And it's hard to navigate that when you're well, let alone if you're ill. And some of our services are not, worked in the public sector for years. I love the public sector. I love the charitable sector just as much. What I'm saying is some of our systems are almost a bit like a box ticking or a process system that doesn't have an outcome. So impact projects absolutely have to have an outcome. They have to say, we saw 300 people and 162 of them have got jobs at the end of our project. They absolutely have to do that. I don't think that's a bad thing. And I think that should be level playing field applied to the public sector, to the charitable sector, any sector. We should know these sorts of things. So there's a good democratization around this in impact terms. So anyway, I was saying governments can, invest a little to get a lot. They can offer their soft strategic support. And I think the final thing that can be done at local authority level, it can be done across organisations, combined authorities. It can actually start to say, this is what we want. We're not pushing out procurement in that empty-headed way of you get a few months grant, and before you've even set up, you're starting to pack up because it's only a year-long grant. They could start to say, we understand that it's going to take a few years to change that tide. It won't happen overnight. Some of the systems that we've got now have taken 20 years of eroding elements, not to focus on the youth sector because impact works across all sectors, but actually, if you remove over 20, 30 years all the youth clubs and all of the filters and options that young people had, sure enough, you'll find them all at the crisis end. It's what we've done. The same happens around mental health and a range of housing. What we can do is start to understand, yes, we've got a lot on our plate right now, but the way that we can start to see something new emerging is by doing impact projects, because they're piloting, they're learning, they're evolving projects. They're not about sticking out another tender saying, well, we'll take the cheapest and hopefully that'll do something. There's no hopeful about it. Impact projects measure things. Some people say over measure them. They're data rich, but in a way, you do need to prove that level of competence and that level of quality and that level of, this is because we were there, we did this. And I think that's not a bad thing for any form of investment.
So I totally agree with you. And I've got to come to Lorraine, and I've got a couple of questions as well. And I hope, Lorraine, you can give us a bit of an insight into this, because I think this fundamentally boils down to leadership, what you've just been describing there, Lee, because having worked in the public sector and you look with the voluntary sector, there's always a disparity there. And I think the public sector leadership need to look at the voluntary sector leadership and bring that in to context, and also share those metrics. When you talk about measurement, you can measure everything, particularly in the public sector, because I was a chief officer of a statutory agency. So I know how to measure things and I know how to present that to government. You can share that information to the voluntary sector. So Lorraine, what would your thoughts be on that? And then also just some sort of final thoughts on this webinar and context over the next couple of years.
Okay, on leadership. I was interested the other day to read a post on LinkedIn, which I'm on all the time, from an elected member in a local authority area in Scotland who was going off his head at the cost that had been spent on a family. So, something along the lines of £1 million spent on a family. And the big issue for him was the amount of money that it cost. And I thought, imagine if the big issue for him was the outcome that family were getting. Would that change things? And I really hope it would. So there's definitely something about leadership, but leadership about really moving into the space of things are quite difficult to do, things are quite difficult to measure, but we're going to do it anyway because it's the right thing to do. A couple of things. So we've talked about young people, we've talked about addictions. So it doesn't matter what we talk about. The people that are trying to prevent young people from moving into offending are the same people that are trying to prevent people from being homeless. They're the same people that are trying to prevent young people from moving into care. And we're all looking for the same things. We're all looking for a real response to poverty, a real sense of everybody getting equal access to opportunities. And we're all talking the same stuff, but we're all talking about it in our silos to the people that we think can influence what we do. Now imagine if we all got together and did something collectively and really thought about what are those outcomes that we're trying to get to. And I say this in a country that has a national performance framework that is based on outcomes. So I'll leave that with you for a wee think about. The other two things, I suppose, in terms of well-being economy, I would say again, Scotland has in its manifesto commitment, in its programme for government commitments, a real commitment to thinking about a well-being economy. So I would say, what is that, and what are you doing around that? And I would say that to everyone on this call. What is it that you're doing that is contributing to a well-being economy? I get frustrated, and I talk to people all the time who get frustrated, and I'm really excited today now because I think that we might have something that might stick, that might help, that might be supportive, and I'll probably just leave it at that. Other than thank you very much for everyone who's here today, and Alex Fleming and Ellen and Fiona. I've found you on LinkedIn, and I'll be in touch.
Brilliant, Lorraine. So look, we have about 2 or 3 minutes left. So I'm going to firstly go to Lee for a short summary, right? And then let Niven finish. Lee, just from your perspective, just over the next 12 months for anyone tuning in here, what would your final words be to them?
My final words will be simple. Transforming and changing and moving forward many of our communities that are struggling is good for us all. It isn't just good for those people who benefit from that service, from that impact model, that design. It's good for us all. And we need to understand that. And we need to understand our relationship with business and enterprises. Actually, if we sever that connection, then what we're saying is there are these people who have needs and some that don't. Actually, I am being very holistic. We actually have to see ourselves as whole communities, understanding there are different sets of needs. That, to me, is the essence of social impact.
Brilliantly. So, Niven, the final words to yourself, because we're coming up on the end of our sort of time slot. Just some summary, some final words of inspiration, and I guess it comes back to the question at the start: how can Scotland lead?
Well, I think the first thing I need to do is go and put some money in Gerry's meter so he could have finished off. But how can Scotland lead? I think Scotland has led in a number of ways, in a number of different areas. But sometimes we get our feet stuck in the mud. We have. I mean, I've talked about the violence reduction unit, and I make no apology for mentioning it again. We've shown the world what can be achieved there, and yet we're still back at a situation where our drug death statistics are the worst in Europe, or if not the world, and we aren't able to do anything about that. So we need to think differently, and we need to work together. And I truly, as a 31-year police officer, I get fed up with people talking about our partners because that's people you meet at a meeting. That is not your partners. And your partners are people that you work with towards shared goals and shared agendas and shared outcomes. and we need to pool the limited resources we have to tackle these underlying issues which are causing all our social problems. And whilst we're doing that, here we get business money that's prepared to pay to get it started and to put us along that road. And it's not something that's new. It's been kicking about since 2010. We've had a very successful project in Scotland, and we didn't have any more. And we need to ask the question why. I don't understand. I keep asking people why not. But we're at that stage just now. I think we have a great opportunity here to move Scotland forward again and to be that example that you talk about, Gareth.
Fabulous, Niven. A great way to wrap it up. I think there's a couple of things that I need to share with everyone. So firstly, if you want to reach out to Niven, Lorraine or Gerry, look at the website, socialimpactscotland.com. And then if you want to reach out to Lee and that, it's Smart Social. This has been a fantastic discussion. I think we're definitely at a crossroads. I think Scotland has the opportunity to lead. And the beauty about this is like we can scale this up, like not just across Scotland, but across the UK and then in wider jurisdictions. I think that's the purpose. I think we have to come together, as we've all stated on this call. And the next steps really are to engage those local communities. I love the way you framed that, Niven, at the end in terms of the partners and co-creating Lee spoke about and Lorraine. So for myself here, we'll just say thank you very much for joining us. And I hope this has been of interest. Really appreciate all the comments, and then we'll close it. So for myself, Niven, Lorraine, Gerry and Lee, we'll say good afternoon and thanks for joining everyone.
Thanks,